Hello, everyone, and thank you for coming to this session. Now, last week we talked about a little bit about different types of drugs, whether they're prescribed, illicit, illegal, and we just touched upon them. Now, for this chapter, chapter 10, it specifically talks about substance-related, addictive, and impulse control disorders. And we're going to be talking about specifically today is going to be different types of drugs, whether they're illegal or prescribed, and what makes them addictive, their symptoms, what is classified to be a disorder of sorts, and the different withdrawal symptoms that we mentioned previously, and as well as resources that can be used in case anyone is suffering from this type of disorder and or addiction. So let's go ahead and dive right into it. And at the end, if you have any questions or anything, I would suggest just writing it down, and then we can go move forward and answer some of those in the discussion. Okay, so let's go ahead and begin. Now let's try the next slide. Let's talk about first depressants. Now, funny anecdote for me is when I started my undergraduate work, I assumed that depressants were, as the name suggests, depressed and being depressed. And I thought to myself, well, why would anybody want to take a drug, whether it's prescribed or illegal, that would depress them or make them feel sad and make them feel down? It didn't make any sense to me until I started taking the psychology courses, and then it dawned on me that depress and depression and depressants mean different things. And in the world of drugs, depressants do not necessarily mean that they make you sad or make you feel down. So, what are depressants? Let's go with that. Depressants are known as substances that lower the activity in a person's central nervous system. Now, what do people usually use depressants for? Now, this is the big question that I always had when I thought of depressants. Typically, depressants are used to relax and or to lower a person's functions. And those things are things that are very important, and we'll go ahead and discuss a bit further in the next slides. So just keep in mind that depressants are known as the substances that lower the activity in the central nervous system. Okay, moving right along, there are different types of depressants and different types of substances that are considered depressants. For example, alcohol, which we'll talk about in the next couple slides, benzodiazepines, sorry if I said that incorrectly, but trying to say the word, benzodiazepines. Cannabis, which is also known as marijuana, THC, and heroin, which I'm sure that most of you have heard of these substances either in elementary school and middle school. I remember specifically for me, I learned about a lot of these substances in middle school, and there was a big campaign back then to just say no to drugs. So these substances were heavily mentioned during that time, just to deter us from using them and from becoming dependent or addicted to any of these types of drugs and or substances. So let's go ahead and move forward and talk about alcohol. Now, with alcohol, it affects different parts of your body, and we'll go into further what it affects specifically of the body. But just as a synopsis real quick, most of the body's organs are affected by alcohol. And although the effects of alcohol use begin as a stimulant, it is considered a depressant. Now, when you think of alcohol use, and specifically I'll use my experiences of seeing others drinking alcohol, for example. When you go to a party and you start seeing people kind of shy, and talking in their groups, but not really commingling or dancing and that sort of thing. And then you start seeing people drinking alcohol, and you start seeing them become a little more vibrant, a little more social, and a little more uninhibited. That's what it means as being used in the beginning when first drinking alcohol as a stimulant. So that's the best example that I can give you regarding using alcohol in the beginning as a stimulant. Now, alcohol is also a substance that slows, and as we mentioned, depresses the inhibition center in our brains. So as I mentioned with my example, when you go to a party and you see that people are not as engaged in the party, or not, singing karaoke or standing up in, on top of a desk or a table and singing to their heart's content. And then they start drinking alcohol, and next thing you know, you have groups of people singing and dancing and having a joyous time. And that's because it slows our inhibition center in our brain, so it depresses it. So by doing that, we feel uninhibited to do things that we normally would not do, or normally we wouldn't per se feel the need to. So it kind of gives us, as people call it, liquid courage, to be able to go ahead and do things that normally we would be a bit hesitant to do. So as the person drinking alcohol continues drinking it, the substance slows further areas of our brain. And as I mentioned before, alcohol affects different parts of our body, if not the whole body. And we'll go into it a bit further in the next slides. So let's go ahead and take a look at the next slide here. And we're going to talk about what's a standard drink. Now, a standard drink can be something as simple as beer, for example. 12 ounces of beer has about 5% of alcohol. So it doesn't seem like it's much. It's a smaller amount. 5 ounces of wine has about 12% of alcohol. So when people say like, oh, I have a glass of red wine after my dinner for good health, it's about 12%, which, for 5 ounces, I think is a pretty significant amount. Now, 8 ounces of malt liquor is about 8% of alcohol, and 1.5 ounces of spirits is considered about 40% of alcohol. So in the United States, a standard drink is any drink that consists of 14 grams more of alcohol. So it's equal to about maybe 0.6 fluid ounces or 1.2 tablespoons. And of course, this varies by the different type of alcohol and the brand as well. So this is courtesy of the alcoholrehabgroup.org. So this is just to give us an idea as far as how much alcohol is included in a drink that we would normally go ahead and have. Okay, so let's move forward, and this is the part that I was talking to you guys about previously. Now this is courtesy of the the Imam Macmillan Recovery Center. And this is just an illustration of the different parts of the body that are affected by alcohol use. So let's start with the brain, shall we? Alcohol can be used to relax. As I mentioned before, it makes us uninhibited and makes us more prone to do things that we normally wouldn't do. So it's a way of relaxing. But it can also become addictive and can lead to dependency. And that's in the mental health aspect of our brain. Now, for our nervous system, alcohol impairs judgment and concentration. So long-term alcohol use can damage the brain and nerves. Now, so we talked about previously how it makes us uninhibited, but it also affects judgment and concentration, which makes a lot of sense because when you think about, for example, videos of field sobriety tests where somebody is stopped, presumably, for impaired driving, and they're giving these field sobriety tests For example, like being able to walk in a straight line, and or being able to concentrate on saying or reciting the ABCs backwards. It impairs, alcohol impairs our concentration. So if you notice in those videos, you see that people are not able to concentrate fully of the task they're being asked to do. So that's another part of the brain that's being affected by alcohol. Now let's go along with the different parts of the body that are affected as well by alcohol use. So being inebriated can cause blurred vision, which is another reason why, it's illegal to drive while under the influence. Because imagine having blurred vision and operating a vehicle that's 5,000 pounds, or, a big vehicle that can be utilized inadvertently or advertently as a vehicle that can cause damage and or death. So if you're impaired and you are driving, imagine driving without having the judgment and concentration. And then to top it off, you also have blurred vision. You need to be able to have great vision, or as best as you can, without it being impaired in order to be able to drive a vehicle safely. So that's also very important to note, the consequence, not so much a consequence, but an effect of alcohol usage and the eyes. Now, your skin is also affected, and it could have direct and indirect effects on the skin, as mentioned in this slide. Now, your mouth and throat. Your mouth and throat can be affected in the sense that being inebriated can cause your slurred speech. So you have blurred vision with the eyes, and then now when you're being asked something, your speech is very slurred and very hard to understand. And if you see these videos that I've seen, for example, on YouTube for field sobriety tests, and they're being asked a question by a police officer, for example, and their answers are very muffled like, or they just don't make sense and you can't really understand very clearly what they're saying. That's the effect of being inebriated with alcohol. That has an effect on your mouth and throat. Now, this is something that I did not know myself, but that in women, alcohol usage affects the breast. And I did not know this, but long-term alcohol use increases the risk of breast cancer. Now, that is very interesting to me, because coming from a background where cancer does run in my family, it's interesting to note that long-term alcohol use can make you more susceptible to risk of having breast cancer. So that's very significant for me. Now, your bones and muscles are also affected by alcohol usage. And what happens is that alcohol affects the coordination. So as we mentioned, as far as not being able to walk a straight line during a field sobriety test, for example, it affects your coordination and it increases the likelihood of injury. So I have a friend that when she was in her 20s, for example, she gave me permission to provide you guys with this story. So she used to drink Friday, Saturday, Sunday. Typical, you get out of work, you socialize, you do, all these activities, and, go to parties and such. So one time she was inebriated, not to the point where she blacked out or anything, but she was driven back home by a friend who was not inebriated. And as she was walking to her home, literally on the sidewalk, she had, she wasn't coordinated and she was wearing high heels, and she basically slipped and fell back. And as a result of that, she caused damage to her vertebrae and has been having back problems and back surgeries and such. To this day, it affects her and affects the way that she deals with specifically weather changes. When it comes to being winter time, she has a lot more pain and just problems with her spine and vertebrae. So that's something that has affected her as far as her bones and muscles and her movements as well. So that caused an injury as a result of drinking alcohol. Now I understand that not everybody is going to have something as severe as that, but that's just an example that I could think from the top of my head where alcohol affected the bones and muscles of this person. So ongoing heavy alcohol use can also have other health effects on the bones and muscles. Now next we look upon the kidneys. Now alcohol has an effect on kidneys functions, and that's something that, if we think about, it would affect your kidneys functions because the alcohol eventually comes out through the urinary tract system. So kidneys are very important, and while drinking socially, typically would not cause, such an effect on the kidneys functions, long-term use can also affect it very significantly. Now, the intestines are affected as well by alcohol because both the large and small intestines are affected by longer-term alcohol use, including a higher cancer risk. So let's talk about the other parts that are on the right side of this slide. The lungs. The lungs are affected because heavy use can increase the risk of infections of the lungs. The heart can also be affected by the alcohol use, and even low levels, um, as told. I remember reading a study talking about the effects of drinking, for example, red wine after dinner. Just a small amount, not a large amount, that can be beneficial to your heart. But it's harmful, alcohol usage is harmful at a higher level or a more consistent level every single day. Can affect the heart in a negative way. Now, your liver can be affected as far as long-term alcohol use. It could cause damage to the liver and in a variety of ways. And now once you damage your liver, there's something that's called cirrhosis of the liver, where literally your liver is not functioning the way it should and could lead to needing a transplant and that sort of thing. So it's very important to note that heavy usage can ultimately affect the liver in a negative way. Now, it also can affect your pancreas because when heavy usage of alcohol takes place, it can cause chronic or acute pancreatitis or inflammation and damage in the pancreas area. Now, your stomach and food pipe can also be affected by alcohol use. Too much alcohol can have a short-term and or long-term effect on your food pipe, which would be the esophagus, and the stomach as well. So if you can see from this diagram, you can see that so many parts of the body are affected by alcohol usage. So it's very important to note that it's not just, for example, depressing the brain or depressing certain parts of the nervous system. No, it actually affects so many other areas of your body. So let's go ahead and move forward with the next slide. And we're going to talk a little bit more about a depressant and alcohol usage. So alcohol, as we mentioned, depresses the central nervous system. Now, it reduces your heart rate, it lowers your blood pressure, it affects body movements and memory, as we mentioned in the previous slides. It slows your breathing. It could lead to headaches and dizziness. So what's considered to be a hangover, for example, when you wake up the next day and you feel nauseous and or dizzy and or have headaches, that can also be because of the alcohol usage and also because the alcohol effects are still with you and there is no hydration other than just the alcohol. And it can cause confusion as well. So disorientation, where somebody may not know exactly the events of the night before or may not know how they got to the location that they're in, for example. Now, here are some, just reiterating what we talked about as far as the effects on the body of alcohol. So what happens is alcohol travels through our esophagus, right? So it travels through our food pipe. And it goes down to our stomach and down to the small intestines where it enters our bloodstream. Now, through our circulatory system, alcohol ends up touching every organ, including the heart, as we saw on the previous slide. The lungs vaporize some of the alcohol and some of it is exhaled. So if you notice, sometimes when you're around somebody that has been drinking alcohol, you can literally smell it in their breath. And that's because the lungs are vaporizing some of that alcohol and the person's exhaling it. So then alcohol passes the liver where it turns into carbon dioxide and it turns into waste. Now, alcohol in the brain. So we talked a bit about how it affects your central nervous system in different parts, and also how it depresses and or brings about whole stoppage of inhibitions. Now, the neurotransmitters of the brain are affected by alcohol use, and they're unable to fire properly. So it causes our inhibitions to be lowered, as we mentioned before. Alcohol also affects our cognitive functions, such as our memory of our alcoholic intoxication. So as I mentioned before, there could be moments where a person wakes up, does not know how they got to the room or what exactly happened during the time that they were, under the effects of alcohol. And although alcohol may make a person more talkative and sociable, as I mentioned before, our neurotransmitters are not able to properly function. So that has an adverse effect on our brain. Now let's talk about, since we've talked about the effects that alcohol has on our brains and our body, I'd like to talk about how alcohol use disorder is identified. Now, the Diagnostic and Statistic Manual of Mental Disorders, 5th edition, or as it's known, the DSM-5, and we've talked about this in previous sessions, and we've talked about different disorders. Now, coming with alcohol use disorder, the DSM-5 is used to describe alcohol use disorder. And there's specific guidelines in order to be able to be diagnosed with alcohol use disorder. So it describes alcohol use disorder as 2 or more of the following areas within a period of a year. So if a person has 2 or more of these within a period of a year or 12 months, then they may be considered to have alcohol use disorder. So one of the things that is a criteria for alcohol use disorder is wanting to use alcohol, so craving it. So when people say like, oh, like I just want to have a drink, for example, after work, you don't typically think somebody's craving it. You just think like, oh, they probably had a bad day at work. But somebody that is literally wanting it, like craving it, like my best analogy for it would be somebody that wants chocolate and is craving it. Like, oh, I have such a craving for it, I'm going to go and get that. And rather than get anything else, they just get alcohol, for example. That's just a way to kind of think about having a craving for it. Now, also another criteria would be the inability to control and or curb your alcohol consumption. So somebody that says, oh, I can stop at any time, for example, or I could just have one. And then next thing you know, they have a 12-pack. And it's consistently they're doing that, and they're unable to control it or unable to curb the amount of which they're drinking. Also, another criteria would be using alcohol for extended periods of time and or longer than intended. So saying like, okay, I'm going to drink just, during this, you know, celebration, for example, like during the holidays. And you see them drinking and you're like, okay, they said that that's what they're going to do. And then next thing you know, they're drinking 3 times a week, 4 times a week, the whole week. And they're using it longer than they originally intended to. That's another criteria. Now, another criteria would be also spending longer periods of time in activities to use alcohol and to recover from their effects. So instead of just saying, I'm going to drink, for example, in social occasions, and you notice that this person typically doesn't go to a lot of different social occasions during the week, going from maybe once or twice a week going to these social occasions where alcohol is present to literally going 5 times a week or the whole week and consistently doing that, and or recovering from their effects and taking longer to recover from the effects because they're constantly drinking, so it's taking longer for them to recover. That's another criteria. Now, failure to keep up with obligations due to alcohol use. Now, that's a big one, and that's something that I've seen personally with extended family. I've seen that, for example, extended family members that have obligations to take care of their children or provide for their children. And, at one point they start drinking, and then next thing you know, they're not able to take care of their children physically and economically. I've seen that happen, and that's also another criteria, for example, when it has to do with the failure to keep up with obligations and directly due to their alcohol usage. Now, using alcohol despite interpersonal and or social problems that are caused or exaggerated by the effects of alcohol. So, knowing, for example, this is just a quick example, that maybe your spouse might not like you drinking alcohol and it causes problems between your relationship with you, your spouse, and or your children. And continuing to use it instead of just saying, or actually just making an effort to stop or stopping, for example, and knowing that those interpersonal problems and social problems are going to continue and or just become more intense due to alcohol usage, but unable to speak, to stop using it, can also be a part of the criteria. Now, giving up important activities due to alcohol usage. Now, that's another criteria for alcohol use disorder. And I've seen this, for example, I've seen friends who in the past were very active in their kids' lives and going to their different sporting events or their different events as far as recitals and that sort of thing. And then suddenly you see that they go less and less to the point where now it's known that they're not going to be going to these important activities or important family functions due to their alcohol use. Now, here's a really important one that I think is quite important and poignant, is using alcohol in physically hazardous scenarios. And that's as simple as using alcohol while driving. Having alcohol in your car and knowing that you're in a hazardous scenario. You're driving a big vehicle that can cause damage and or death to people, and drinking alcohol while driving, having had alcohol prior to driving, and just using it in these physically hazardous scenarios that can cause harm or death to yourself or cause harm and death to others. That's a big criteria for alcohol use disorder. Now, also developing tolerance to alcohol and needing to use it more to be able to achieve that effect of relaxation or that effect that they're desiring. And having had more alcohol usage and having that tolerance, in not having that effect that is being desired while using the same amount of alcohol. So where, for example, having 6 alcoholic beverages gave that person that freedom or that feeling of not having inhibitions, to where now those same 6 alcoholic beverages are not doing the same effect, and they need to have more because that same amount of alcohol is not giving them that effect, and they're developing a tolerance for alcohol. And lastly, suffering from withdrawal and using other substances to avoid symptoms. So, for example, they're starting to have feelings of, trembling or like other withdrawal symptoms that they might have. And instead of having to feel those withdrawal symptoms, they decide to use other drugs or other substances to kind of avoid those symptoms so they don't go through that withdrawal period. That's also something that's very important to point out and can be used to describe alcohol use disorder. Right. And as I mentioned in the beginning, we weren't just going to talk about alcohol and the different effects that it has on the body and the alcohol use disorder, but we're also going to provide resources that can be utilized by anyone that is suffering from alcohol use disorder or thinks that they're suffering from alcohol use disorder or needs help in order to just curb the alcoholic drinking. And if you or someone you know is suffering from that, these are some very helpful resources to utilize to help yourself or someone that you know. So first we have the National Institute of Health, the NIH, and here is the website where you can get information on treatment and getting help. We also have the American Psychological Association, the APA, and this website for substance use and addiction to alcohol and alcoholic disorders is another resource that can be utilized. And we have also Alcoholics Anonymous, which is, as we all know, AA, and that's also another resource that can be used as a helpful resource for curbing alcohol usage and such. So this is what we're talking about when we talk about depressants, and this is a very big depressant, and if you notice in your book, it's very heavily, extensively explained because it's one of the most common that a lot of people are familiar with. So let's go ahead and move on to the next slide. And now let's talk about benzodiazepines. And I say that a little slower because I have trouble with the word, but for right now I'll say benzodiazepines, but I'll shorten it down to benzos in the future, and you'll know what I'm talking about. So let me go ahead and say it one more time, and then we'll talk about them as benzos. Now, what is benzodiazepine? Benzos is a type of prescription drug that is used mostly to help people lower their anxiety. So there are different prescriptions that go and have that common usage of benzos in their drugs. And these type of prescriptions go by different names. So for example, a very common one that is utilized is called Xanax. There's also Valium and also Ativan. So benzos are believed to be less addictive and safer to use than barbiturates. Now, barbiturates were used typically before the 1960s. They were prescription medications that were used for anxiety and such. But these barbiturates were, there weren't any effects that clearly, for example, people knew about as far as addictive effects, but it did come to light in the 50s and 60s that barbiturates were highly addictive, and so it was a bit of a transition period to where benzos were being replaced for barbiturates. So let's go ahead and delve a little bit further on benzos. So as we mentioned, clinical use of benzos, we mentioned previously that they're used to calm an individual, to relax them, anxiety, and also to help them sleep. So they can be used as a form of muscle relaxant or also an anti-seizure medication. So these are all clinical uses of them. They can be used to produce a feeling of well-being and to relax a person, and for people with certain phobias. Yes, believe it or not, benzos can be used for example, I'll use myself in this. Growing up, I had a big fear of flying, and I was prescribed Xanax to take an hour before my flight, for example, and to take that medication so that by the time I boarded and by the time the flight took off, I would feel a bit better and a feeling of that well-being and just being more relaxed and feeling calm so that I can go ahead and proceed with my flight without having that specific phobia basically taking over and causing me to panic. So that's something that I've taken in the past due to my fear of flying. So that's a specific phobia that I have that I've used Xanax for, and it was clinically used for that purpose. So let's also talk about the flip side of that, which would be the misuse of benzos. And that's something that unfortunately is quite common in our society, is misusing prescription drugs and medications. So when a person first uses benzos, they experience a similar reaction as to the effect of alcohol. So we mentioned how alcohol people use to kind of relax and kind of just depress those inhibitions, and benzos are similarly used to relax as well, and they have a similar reaction. Now, there's a feeling of lowering of inhibitions, and there's a feeling of feeling almost kind of euphoric or having that high feeling. In time and with repeated use of benzos, however, there is a risk of dependency and addiction. And once a dependency is established with the usage of the benzos, the withdrawal effects mimic those of alcohol withdrawal. So here's just another example of how a depressant, as benzos, is very similar to another depressant, which is alcohol, and how the withdrawal symptoms can be quite similar. Now, another type, and I wanted to mention this specifically, I know that we hadn't talked about this in previous slides this week, but we kind of mentioned it a bit last week. So I want to go ahead and touch a little bit further on Rohypnol, because in the news we typically hear of it a lot, and I wanted to touch base with just what exactly it is and what it can be used for clinically and what it could be used for also criminally. So I think it's very important to kind of discuss this. Now, Rohypnol is a type of benzo that is widely known to be misused for illegal and or illicit purposes. It's known by the names of roofies, Rofenol, and it's known as a date break drug and a forget me pill. It does not have any significant odor, but it does have similar effects to alcohol. And that's very important to point out, because this type of depressant has been used in the past, and I believe that it's still being used, as a way to take sexual advantage of not only women but also men, by putting, for example, the person, I'll give you guys a clearer example. Let's say you're at a bar or a restaurant and you're sitting there and you're having a beverage of sorts. Somebody can befriend you and start talking to you. And when you're not looking, place this type of benzo, Rohypnol, in your drink. Now, because it doesn't have any odor or it doesn't taste different, you're not going to know that this substance is in your drink. And because it has a similar effects to alcohol, you're going to think that you're just feeling the effects of the alcohol and not this type of benzo. So it can be placed in an alcoholic drink so that the person can feel a bit sedated, and it'll be easier to be abused. And you've heard these stories of date rape drugs. This is something that can be utilized as a date rape drug. So it's important to point out that it has been used in the past as this type of date rape drug or a sedative in order to be able to kind of, abuse the other person. And this is something that has become, unfortunately, something that's become widespread and can happen at any time. So it is something that I wanted to bring up just to let you know a bit more about what type of medication it is and how it can also be used, not just for its intentional purpose, but also for illegal purposes as well and criminal purposes. And that's sort of kind of what the Drug Enforcement Agency, the DEA. This is a picture that they have of what roofie or Rohypnol looks like. Now, in its pill form that way, seeing it, you would think like, why would I want to take something like this if I'm not prescribed it? But as I mentioned before, being out and having that placed in your drink, you're not going to taste it, and there's not going to be a distinct odor to it. So just something to keep in mind, and this is just what it typically looks like coming out of a bottle. Now let's go ahead and shift gears and we'll talk about sedative disorders, and as far as the benzos, because benzos are considered to be a type of sedative, as we mentioned with Xanax and Valium and even Rohypnol. So the Diagnostic and Statistical Manual of Mental Disorders, 5th edition, the DSM-5, describes sedative disorders as having a pattern of significant distress or impairment, with 2 or more of the following happening within a period of a year. So, for example, a sedative can be benzos, for example, that are taken for longer periods of time or in larger amounts. So also, a person wants to quit using the sedative and or has a desire to stop using it and is unable to stop. That's another indicator of having maybe a sedative disorder. Now, the person has a strong craving or desire to continue using the sedatives and is unable to stop. That's an indicator, but also a lot of time that it's needed to recover from the effects of these sedatives, and a great amount of time that is being utilized and taken in trying to obtain these sedatives like the benzos. And as mentioned in the alcohol use disorder, also failing to fulfill major obligations and due to the usage of the sedative, and continuing to use the sedative despite seeing the negative effects that it's having on interpersonal and social problems due to its use. And very similarly as alcohol use disorder, for sedative disorder, also continuing and continuing to give up important events and reducing these important events due to sedative use. And using the sedative in physically dangerous situations, very similar to alcohol use disorder, where a person is placing themselves in a physically dangerous situation, using heavy machinery while using these sedatives, in other dangerous situations. For example, it could be something as simple as taking a bath and using these sedatives, these benzos, and misusing them to the point where you're placed in this physically dangerous situation where you have water all around you and you can literally fall asleep and drown to death and that sort of thing. So that's another thing that, another criteria to consider for sedative disorders. And despite suffering from physical or psychological problems due to the use of these sedatives, a person still continues to use them and to crave them and to want to use them. And as well, avoiding the withdrawal symptoms, very similarly to alcohol use disorder, by continuing to take the sedatives and or using other depressants or other drugs to avoid feeling those withdrawal symptoms. So for example, they could be using alcohol to avoid feeling the withdrawal symptoms of not using the sedative. Now here's an illustration of the symptoms of benzo withdrawal and the different parts that are affected by the withdrawal of using benzos. So for example, you may have nausea. Nausea is something that also is common in alcohol use as well. Insomnia. So a person can have withdrawals from not utilizing the benzos and may experience a lack of being able to go to sleep. There can also be grand mal seizures, where a person is literally debilitated by these seizures, and these seizures can cause physical as well as mental injury, and it could lead to death. Now, having abnormal body sensations, so where the feeling that you have, like for example, just insects crawling upon you and you feel itchy and you just want to like get rid of that abnormal body sensation that you're having, but that can also be a descriptor to a withdrawal of the benzos. You could have unusual aches and pains where all of a sudden, different parts of your body are hurting and you feel achy and sore and you don't know why. That's another symptom of the benzo withdrawal. You can have delirium, or what's considered to be detachment from reality. I think of it more of like, people that think existentially, like, okay, like, am I here? Am I really here? Is this really reality? Am I imagining things? That sort of thing. And that's something that can be a symptom of the benzo withdrawal. You could have muscle spasms where you can't control your body. Different muscle groups in your body are starting to spasm, and that can also be a symptom of the benzo withdrawal. Having anxiety and panic attacks. That's something that, excuse me, I have a little allergy myself, but having anxiety or panic attacks is something that can be a symptom of the benzo withdrawal, which is ironic because the usage for benzos is to be able to relax and not have anxiety provoking thoughts and panic attacks. So it goes against kind of like what, for example, the original purpose of benzos were. So these are just some of the symptoms that are caused by benzodiazepine and the withdrawal symptoms. And as I mentioned before, for every time that we talk about these different disorders, like to be able to provide not only what they are and what the descriptors are for the disorder, the withdrawal symptoms, but I'd like to be able to provide helpful resources that can help either you or someone that you know obtain resources for help. So in this case, we have the National Rehab Hotline, and that's the website providing more information on benzos and addiction. And we also have the American Psychological Association, the APA as they're known, and more information on addiction and substance use disorders and what is a substance use disorder, as well as being able to provide more information on rehabilitation. And we also have Narcotics Anonymous, which is very similar to Alcoholics Anonymous, but in this case, Narcotics Anonymous deals with drugs, whether they're illicit, whether they're prescribed or illegal. They deal with the substance use of drugs, and they're known as NA, and that's the website where you can obtain more information as well. So moving right along, let's talk right now about opioids. And I'm sure that you or someone that you know has heard of opioids and the different and adverse effects that opioids have, and what the differences are between, for example, alcohol use and sedative use with the benzos and opioids. So let's get started. Now, what are opioids? Originally, the term opioid was used to describe the naturally occurring substances that occur inside the opium poppy. So the opium poppy is a particular plant, and inside there's naturally occurring substances that are used, and that's what an opioid is known for. Now, opioids are known as all substances that encompass this naturally occurring opioid or opioids, and they're synthetic variants, and they're those that occur naturally. So for example, beta endorphins that occur naturally. Okay, and the uses and effects of opioids. Now, opioids in itself can cause drowsiness, they could slow a person's breathing, and they can increase euphoria. And they typically are legally prescribed to use as an aid in relief of pain, or as they call it, analgesics. Excuse me, I'm saying the name wrong. Analgesics. Okay, so I don't know how to say that word exactly correctly, but it's a way to relieve pain. So that's the typical usage for an opioid. And let's go ahead and go a little bit further, and we're going to go ahead and talk about the different types of opioids that are available. So we'll talk about here, there's 4 in particular that I'd like to go ahead and discuss, and they're hydrocodone, methadone, oxycodone, and heroin. So let's go ahead and talk about hydrocodone first. Now, hydrocodone is an antitussive, that's what they call it. So it's basically a cough suppressant and a narcotic analgesic. I know I'm saying the word wrong, and I apologize, class. It's a narcotic agent for the treatment of moderate to moderately severe pain. So there have been various studies that illustrate that hydrocodone is effective, and even more effective than something like codeine, for example, for cough suppression, and equal to morphine for pain relief. So it's very good for as far as a cough suppressant for legal purposes, and also for pain relief, also being prescribed for legal purposes. Now, hydrocodone is one of the most frequently prescribed opioid medications in the United States, believe it or not. So a lot of the medications that are used contain the products of hydrocodone, and millions of these have been prescribed in the United States in recent time. And so there are different brands. Actually, there are hundreds in the research that I was looking at, hundreds of brand name generic medications that utilize hydrocodone and that are marketed with hydrocodone in mind and in combination. So the most frequently prescribed combination is hydrocodone and acetaminophen. So for example, I'm sure that some of you have heard these names like Vicodin or Lortab. Those are the most frequently prescribed combinations of hydrocodone with acetaminophen, which is the main ingredient in something as simple as Tylenol. So hydrocodone is a type of medication that has been abused a lot because of its opioid effects. And there's been a lot of illegal activity in the usage of hydrocodone because of its opioid effects. So there's been a lot of things where people alter the prescriptions, or there's been thefts and illicit purchases. Even online resources are used and purchased illicitly from online sources so that hydrocodone can be misused. Excuse me. Can be misused. So it's a little harder to have control over hydrocodone, especially in the times that we are in now with the internet and being able to purchase these pills for misuse. So their hydrocodone pills are actually the most frequently way that they're illicitly trafficked as illegal pills and being generally abused. It's something that is more used in pill form and abused orally. Oftentimes, hydrocodone is actually used in conjunction with alcohol. So it's being able to have that high of the alcohol combined with that pill, hydrocodone. And there is, among school-age children, there have been studies that there's been a trend of illicit use within teenagers and kids in high school. So it's something definitely to be concerned of. And Vicodin is one of the more popular types of hydrocodone medication and is one of the most abused hydrocodone medications for non-medical purposes that is currently being used, and they associate that with deaths as well of usage of Vicodin as well. So it's a lot of different things that encompass hydrocodone, but I'm sure that you've all heard of Vicodin and its effects as well, and just with the abuse. And as with anything that's abused as far as medications are concerned, the usage of it and the abuse of it is associated with tolerance, with dependency, and with addiction. So there's that risk of misusing the medication for the other than the purposes that it was intended to, and misusing it as far as having more of it and being able to take higher doses of it and causing an addiction of that sort. So it is something to keep in mind. They're considered in tablets, they come in capsules, they also come in liquid form if you buy them illicitly. Tablets are typically the most frequently way that people use them, and so they're a source that definitely can be abused, and another way that people can obtain these more illicitly is by, as they call it, doctor shopping, where they go from one doctor to another, getting them to legally prescribed hydrocodone by going to all these different doctors and having all these different prescriptions, so that they have a big stockpile of them that they can go ahead and utilize for illicit purpose as well. And the alteration of the actual the prescription and the prescription note as well. So it's something to definitely just be mindful of. Now, the next one that I want to talk about is for methadone. And for methadone, it's similar to hydrocodone with methadone, but as well, it's a type of opioid that is used, and it's something that's actually used originally to treat opioid use disorder, which we'll talk about in the next slide. But methadone is considered to be a long-acting opioid agonist and a controlled medication, Schedule II, and the usage of that is to be able to treat those that have a diagnosis of opioid use disorder. So originally, methadone was used to treat the opioid use disorder, but there have also been known that methadone can be used as well in a format of illegal and illicit use. And usually it's only dispensed methadone for the purpose of treating and helping people with opioid use disorder, and it was medication that was approved by the Food and Drug Administration, and it's used mainly to treat opioid use disorder, but also can be used as another form of pain management. So when it's taken as prescribed, methadone is safe and it's effective, and it helps the people achieve recovery, sustained recovery, and just be able to kind of reclaim their lives and be able to live a more meaningful life. Now, methadone is just one component of a treatment plan when it comes to opioid use disorders, which also includes counseling and different types of therapies, as well. And its main use when it's used for opioid use disorder is to reduce those cravings, those opioid cravings that people that have opioid use disorders typically have. And it also kind of blocks the effects of opioids. It's usually taken daily, and it's available in liquid, powder forms as well. And so that's something that came about to be able to kind of combat a bit more the opioid use disorder. And so it's something to definitely keep in mind when you hear of methadone. Just think of it as the way to be able to kind of combat that disorder. Now, speaking of the different types of opioids, another one that's very common is oxycodone. And oxycodone is also a semi-synthetic narcotic, and it's been popular as a abused drug with people that use narcotics and that sort of thing. And it's different names for it. There's been different names for it. There's one name in particular that I thought was interesting. It's called hillbilly heroin, and kicker, OC, ox, roxy, perk, and oxy. Now, it's usually abused orally, or it can also be done intravenously by using needles and by crushing the tablet as well, or sniffing it, dissolving it in water once you crush it, and injecting it. There's been instances where people heat the tablet and put it on foil and inhale the vapor. So there's different ways of misusing oxycodone. And some of the effects of oxycodone include for pain relief, for sedation, for lowering your respiratory rate, used for, there's been instances where it's used for cough suppression. But where it comes a problem is where extended use of it, so chronic use of oxycodone, can cause severe limb damage. It could cause euphoria and feelings of relaxation, um, in the brain area. And that's one of the reasons why a lot of people use it, because for its potential high, that feeling of high, that has more of a potential for it to be abused in order for people to kind of continue to feel that high. So the effects of an overdose include having drowsiness, but to an extreme, muscle weakness. You have cold and clammy skin. You have pinpoint pupils. You have confusion, shallow breathing, as we mentioned with the lower depressed breathing rate. Your heart rate, it also slows. You can faint. You can go into a coma, and you can literally die from abuse of oxycodone. And that's something to definitely keep very much in mind. And also, we've talked about previously about heroin. So these are just some of the types of opioids. There's a lot of different types of medications that are abused, but these are 4 of the most common types of opioids that are abused and used illicitly. So let's go ahead and go to the next slide. And in the next slide, we're going to go ahead and talk about opioid use disorder. Now, so for the next slide, see here, moving forward to the next one. Next slide here. The DSM-5 describes opioid use disorders as a pattern of significant distress or impairment, and having that with 2 or more of the following things happening within a 12-month span or a year period of time. So opioids are taken for longer periods of time and in larger amounts. And a person may want to quit using these opioids and has the desire to, but they're just unable to. And they can't stop, and the thing is, they can't stop craving it or having that desire to continue using it. And again, being unable to. And needing a lot of time to recover from the effects of the opioids. And a great amount of time needing to just be able to recover from it, and to using a great amount of time to try to find these opioids as well. And again, something that's very common with the other disorders is the failing to fulfill major obligations due to the usage of the opioids, and continuing to use opioids despite having those social and interpersonal problems due to its use. And again, something else that's very common with these disorders is giving up important events or reducing these important events due to the opioid use, and using opioids in physically dangerous situations, and you still continue to use those opioids even though you're suffering from physical and mental effects from using them, and trying to avoid the withdrawal symptoms by using other depressants, for example, such as alcohol and benzos. So that's something very important to keep in mind as well. Now let's talk about opioid withdrawal. And in the next slide, it's going to be more of a description of what exactly happens from the moment that the person stops taking opioids, once they become dependent of them, and what happens in this timeline, okay? So with opioid withdrawal timeline, now you take your last dose. For example, in this timeline, it shows your last dosage, and as you can see, within 72 hours, there's a peak, and it's a peak physical symptoms. And those physical symptoms can be very, very intense, and that's one of the main reasons why a lot of people decide to continue using opioids and or other substances and abuse them to avoid these very harsh symptoms. So it could be fever and chills and body aches, dilated pupils, diarrhea, muscle pain, nausea, insomnia. So all these physical symptoms are coming at you at once within 72 hours of the person taking the last dosage. Now, within a week, as you can see, that peak starts to kind of go down a bit. They start to lessen the physical symptoms, but the physical symptoms are still there. So there's still the tiredness, the body aches, the anxiety is still there, the irritability, the nausea is still there, and now there's sweating as well. So although the symptoms lessen, they're still there, and it's still a bothersome experience. Now, within 2 weeks of the last dosage, as you can see, it went from the peak at 72 hours, down week, and now in the 2 week, you see that it's going way down. There's still some psychological and emotional symptoms from the withdrawal of opioids. So that's depression, anxiety, there's irritability, restlessness, and trouble sleeping. Now, within a month from the last dosage, as you can tell, that's the lowest point here in the timeline, and there are still cravings and depression. So these symptoms can linger for weeks and or months after the last dosage. That's why, if you notice, it's very hard once there is abuse of these opioids. It's hard to basically kind of withdraw for them, and it's usually suggested that if you are going to stop, to have medical help and have an expert help you with being able to stop, because just being able to deal with some of these symptoms is hard enough by yourself. So if you have a medical expert that's able to help, then it's much better. Now, the symptoms are not going to be, easier to deal with, but a medical professional could definitely go ahead and they know the right way to kind of be able to stop these opioids and the abuse of them. So as you can see, it's not as easy as just once you become addicted to this medication that's being abused. It's not as easy as just to say, okay, I'm just going to stop cold turkey, as they say, and that's that. There's a lot of different physical and psychological symptoms that come with that that may be very difficult to stop the cycle of abuse. And lastly, we have here, as I mentioned before, I'd like to give some helpful resources for opioid abuse and opioid use disorders, and some prevention and some way for treatments and that sort of thing. So for the Centers of Disease Control and Prevention, here's the website, and they have a lot of resources when it comes to overdoses and prevention of opioid use. Now, the U.S. Department of Health and Human Services is also a good site to look at treatment options for opioid use. And as always, Narcotics Anonymous, that deals with the abuse of different types of drugs, NA, has a lot of resources and a lot of information when it comes to opioid use disorders and just the utilization and the wanting to get help. So these are all resources that can be used for opioid use disorders. And if you or someone you know is suffering from one of these, then this would be definitely a good way to go about, a good route to be able to get some help. Now, as always, after this presentation and talking about this chapter, I would like to get some feedback from all you students about what you found to be helpful or useful as far as the slides and the presentation, and what are things that maybe you might want some more information of or some additional clarification. It's always important to know these things, and you can go ahead and mention this in your discussion questions. And if you have any further questions or anything else, feel free to contact me. You guys have my email address where you can contact me through Canvas. You can also contact me through the numbers that I provided in the syllabus, schedule office hours with me, or go to just the regular weekly office hours that are listed in the syllabus. And as always, if there's anything else that I did not include that maybe you want me to include in the future, or that you feel is needed, just feel free to let me know. And we'll definitely have a good discussion this week about these different disorders. And hopefully this helps you guys with your paper that you're writing next week, and also with the exam that's coming up. All right. And I will talk to you guys soon. Thank you. Bye-bye.